Hi, I'm Kevin Morgan, and this is Kazim Chaudhry. Today we're going to demonstrate a diabetic foot exam. Current clinical guidelines recommend that you have a physician check your feet if you're a diabetic at least once a year. And 1 in 4 people will have foot complications that do have diabetes, so it's very important. Once a year by your physician, but the reason I'm making this educational activity is to demonstrate to patients and their family members so they can learn how to do a diabetic foot exam on their own feet. Because say you go to your doctor once a year for a diabetic foot exam and 3 months after your feet were fine, you develop a problem, some type of neuropathy or loss of sensation in your foot, and say you're in the backyard and you step on a nail. Well, you're not going to see your doctor for another 9 months. You don't want to be that guy walking around with a nail in his foot for 9 months. So, we're going to go ahead and demonstrate. There's 3 main things you look for. First, you're going to look just for color. Look at the bottom of the foot, the top of the foot, and in between all the toes. And what you're checking for is any abrasions, any scrapes, any cuts, any deformities in the foot, and any foreign objects that may be actually puncturing or lodged in the foot. Examine the heel, the back of the heel, common areas where you develop blisters along the bony prominences. 2 big problems that diabetic patients develop are problems with neuropathy and circulation problems. So you want to check capillary refill, and you can check that in the toes, the bottom of the toes, and even in the nail beds. And what you're looking for is blanching. You can see better in his toe. Blanch is white, and almost immediately, it takes about 1 second for blood to return. He has good circulation. You're also going to check pulses. Right behind this bony prominence right here, right on the ankle, that's the posterior tibial pulse. You want to feel for a pulse right there. I like to use these 2 fingers. Just a light touch. And he has a good pulse there. You also check the dorsalis pedis pulse. And this one's tricky. Sometimes it's up higher on the foot, sometimes it's down right here, a little bit above in between the big and second toe. But the best way to find it is to start right here and just work your way up. And there it is right there. Right where the foot starts to hump up a little bit. And he has a nice pulse right there. Okay. So that he has good circulation, the foot looks good, no obvious cuts or scrapes, nothing like that. So the last thing we're going to check on his feet are going to be to see if he has any neuropathy problems, any nerve problems or loss in sensation. So what you're going to do in the home, if you go to your doctor's office, they'll have a little piece of monofilament. You use a light touch. Some physicians prefer to use a tuning fork. You can just use a pen. This pen is closed. You don't want to mark on anyone's foot. A pen or anything, and all you're doing, you ask the patient to look away or close their eyes so they can't cheat. And you're just going to use a light touch, and I'm going to ask him when he feels me touching his foot. Just say yes or say anything.
Yep.
And you'll touch in all these areas.
Yep.
All the pads of the foot.
Yep. 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 Yep.
I tried to trick him.
Yep. Yep.
Very light touch.
Yep. Yep. Yep.
All the toes.
Yep.
Okay. So he has no loss in sensation, good color, nice healthy feet. His toenails are well manicured, which is important. In diabetics, you want to tell them to cut their toenails straight across. This will prevent ingrown toenails, any infection, because those small infections like that in a diabetic patient can turn into big problems. They get a little ingrown toenail and it gets infected a lot more easily, and it takes a lot longer to heal than your average patient. Once again, no lotion in between the toes or on the feet, because that can make these areas more susceptible to, increases the moisture, can increase the likelihood of fungus and more infection. So that about covers the foot examination. A couple things you want to tell your patient other than how to care for their feet is check your shoes. Check your shoes daily. Lots of times a small pebble might be in your shoe, or a thorn or something of that sort, and that can be rubbing your foot. And if you have loss of sensation in your feet, that can cause a big problem, especially if it's on the bottom of the foot. I mean, how many times do you look at the bottom of your feet? Not very often. So that's the last thing. That about does it. Thank you.